looking for a program on demystifying integrative oncology with GRYT Health, you've landed in the right spot. I'm Lauren Listowskis, and I'm going to be announcing things, kind of introducing some of our speakers and keeping us on track tonight. I'm the VP of Community at GRYT Health, and this program is brought to you tonight by our Global Virtual Cancer Conference 2021 founding partner, Bristol Myers Squibb, with lots of help and assistance from the Society for Integrative Oncology. So shout out to both of those. We're really excited. It's going to be an educational night. As you can see, this is a Zoom meeting. You are more than welcome to be on camera. We do ask that you stay muted unless you are asked to unmute yourself. But as you know, this program will be recorded, and we'll send an email out after we have the recording fixed up and pretty, and we'll send it out so you can watch us again. Share it with your friends. We'll also work on a summary blog. The best way to view this program tonight, if you go up in the top right corner where it says view and you click on that, you're going to want to look at gallery. Is that correct, Jess? Yes, gallery. We're going to be highlighting the speakers for you so it's a little easier to see since we have so many lovely little Zoom squares, which I love to see. And just as a reminder, this is meant to be informational. Any decisions regarding your health should be made with your medical team. This is all meant to just be informational for everyone here tonight. And without any other time being taken up, I would love to introduce our first speaker. Santosh, you can go ahead and take it away. Thank you.
Thank you so much. And as people keep trickling in, so far there's already over 100 people here, which is great. So I'm Santosh Rao. I am a medical oncologist and an integrative oncologist. I'm very active in the Society for Integrative Oncology, and I am currently the President-Elect for that organization. And we really focus we call it SIO, on using all modalities to help people in a personalized way, using evidence-informed practices, and trying to bring science together with traditional medicine and with a variety of different ways to help people who've been affected by cancer. So thank you all for joining us today. I think what we want is for this to be a very interactive session. We have a group of us who have different expertise in speaking, and we will all kind of hopefully make this entertaining. But feel free to chat and ask questions, or even just raise a hand, interrupt. I don't care. We want you guys to be part of this discussion. We'll save some time at the end. So if you could bring up my slides, please. I have a few slides. We're going to just quickly orient you. So this is Demystifying Integrative Oncology. And we want to answer questions. So first is the definition. And this came from a group associated with the Society for Integrative Oncology. And it's basically, I'll just read this out. Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and/or lifestyle modifications from different traditions alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to become active participants before, during, and beyond cancer treatment. So I really love this definition. I use it. I think it's very comprehensive, obviously. And there's a lot of parts of that because it's difficult sometimes to define what is the nuance of what we're talking about here. Sometimes integrative can sometimes morph into a conversation about alternative. And it's very clear that's not what we're proposing here. We want to use different modalities that are complementary alongside the very best of conventional cancer treatment. We want to be practical. We want to look at evidence as much as possible. Sometimes that's difficult, especially the different modalities we're talking about are not always easy to study. And you can see we're looking at a variety of different practices that touch on different cultural bases, different traditions, and that there's different goals too, and that can be personal to each person too, optimizing health, quality of life, But not just that, we're also trying to improve clinical outcomes as well. It all goes together. And most importantly, we want to empower people to become active participants. Everybody who's been affected by cancer reads nowadays and has their own way of going through this journey. And we want to be partners, and we want to do it in a way that's communicative, but also informative and hopefully helpful. Next slide. So I talk about this. I mean, unfortunately, a lot of our cancers are linked to modifiable risks. You know, tobacco use is still number one. Obesity is on the rise, whereas tobacco is decreasing. We know in certain places, pathogens, viruses can cause cervical, head and neck cancer, or some parts of the world, gastric cancer, liver cancer. Dietary habits, sun exposure is a growing problem. I think stress is controversial, but it has an effect on behavior at the very least. And certainly if you have cancer, stress can be a modifier. We know that sleep disturbances can increase the risk of many cancers, including breast cancer. And one that we don't think about a lot unless you're in an area that's specifically affected is environmental toxins. Next slide. And, you know, this plays out in various ways. And so genetic predisposition can predispose you to cancer, but then there's something called epigenetics, where you take somebody's genes and you can be modified by various factors. And those can be external insults like radiation, toxins, or pathogens. They can be internal, like diet and lifestyle factors related to the hormones, your microbiome, your immune system, aging, diet, and exercise. And we think that there's a progression from normal cells and then sometime in life to a precancer to eventually a cancer. Next slide. So what do we do in integrative oncology? At least in our center, it's a 1-hour meeting. And you know, if you look at the right, and this is based off of an MD Anderson model in Houston, health is seen as a combination of physical, social, and psycho-spiritual. And there are many modalities that are what we call conventional, like chemotherapy, surgery, radiation, etc. And then there are other areas where maybe we don't always touch on the psycho-spiritual, for example. And integrative modalities tend to do that more, you know, more specifically, whether it's meditation, yoga, acupuncture, nutrition, integrative consultation to talk about all these different things. And how can we put this all together? And we want to make it specific to somebody's needs. You know, it may be specific to their own belief system. And then we want to coordinate it. A lot of times I think nowadays care is not coordinated, and it's left to the individual or the family member to try to figure all this stuff out. And sometimes it's not even communicated to the primary oncologist. And I think that there's a better way to do it. We really want to look at what science is out there, and we want to work together with the patient, with the family, as well as with all providers to really get the best care and make sure everybody's on the same page. So you can close the slides, please. I'm going to turn it over to my friend Desirée Walker, who's, you can introduce yourself, Desirée, but she's going to talk a little bit about her experience, and I'll leave it to her.
So greetings, my name is Desirée Walker, and it's a privilege to be with you this evening. Let me start off by saying that I am a member of the SIO, and I'm privileged to be part of their Patient Advocate Committee, their Research Committee, as well as their Health Equity, Inclusion, and Belonging Work Task Force. And so I'd like to say that, you know, I identify myself as a 2-time breast cancer victor. And I'm thankful to say that I've celebrated 20 years as well as 12-year cancerversaries last year. And I have to say that, you know, I stumbled into integrative oncology, and I'm going to share why I say stumbled into it. When I was diagnosed as a young woman, I'm not ashamed to admit that I didn't know what breast cancer was. But it was important for me to educate myself so that I could make sure that I had the best possible experience. And I'd like to say when it started, I have to credit my employer at the time. They offered the female employees of the firm on-site mammographies. because I was technically not supposed to have a mammography done based on the guidelines. But it was a perk that I thought that I could take advantage of. I did, and I'm thankful because I feel that that is why I'm still able to be here today and have this opportunity to speak with you. So what I'd like to say is that, I was always one of those individuals that was focused on health. And so I practiced yoga. I believed in pampering, so I got massages frequently. And so, I was aware of those, modalities in terms of wellness. However, when I was diagnosed, I had a lumpectomy, and it turned out that I was required to have a second lumpectomy. And although I didn't know that music therapy was a thing, I found using music helped me to prepare not only for my surgeries, but to prepare for what I call my radiation therapy, the different therapies, as well as afterwards, having to go and get additional screenings done. And so music has always been something that I found to be soothing, to center me, and also to help me to relax. But one of the things that I experienced, following having my lumpectomies, I was also told that I was ER/PR positive, which was estrogen positive for my type of cancer, which then meant they needed to address that. And through the treatment that I was given, I went into what is called medically induced menopause. And for those of you who have gone through menopause, you know that it is not something for the faint of heart. And so it was so important for me to be able to find natural ways to deal with the hot flashes and many of the other side effects that come from being in menopause. But I do believe, and it's important to state, that your mental state does affect your physical being. And it was important for me to focus on my spirituality and even dabble in meditation just to be able to stay encouraged during this particular time. And as it was mentioned, integrative care was definitely not the way things were packaged when I was diagnosed. And so I'm thankful for all what is being offered now in certain cancer centers in certain parts of the country, in the world for that matter. And so that's a wonderful thing. But I will say that one of the things that I have found, which is definitely part of integrative medicine, integrative oncology, is acupuncture. Shortly before my second diagnosis, I was, having difficulty with neck stiffness, and I had gone to an orthopedist who suggested that I do physical therapy. And while I was doing physical therapy, my physical therapist is the one who introduced me to acupuncture and said that he thought that that would help me in addition to the physical therapy. And I'm really thankful for that introduction. Because my acupuncturist has been with me ever since. She helped me to understand how acupuncture could be utilized in order to support me when I had my second diagnosis. Because obviously, because it was a reoccurrence, it meant that it was a more aggressive disease. And so I had to, unfortunately, undergo a lot of treatment in terms of chemotherapy, targeted therapy, and unfortunately, I was allergic to all of the medications that they gave me, and I experienced a lot of different complications. And I'm here to tell you that acupuncture has really assisted me through those difficult moments to help me deal with many of the side effects that I experienced. And I actually still to this day make sure that acupuncture is very much a part of my daily life. I go and I get maintenance. I've learned so much about my body and how it can respond to the seasons, to various types of treatment, because what was clear was I had sensitivities. And it was important for me to understand how my body works so that I could then look at the various modalities that would serve my mind, my body, and my spirit. And so I have to say that although this is not something that everyone is aware of, because one of the things that I would say is that, in my community, many people, although we do know about certain herbs in the Caribbean, the actual fact is that, acupuncture is not something that we necessarily know to be a modality to consider. And I just think that I'm so thankful for this particular platform, this particular webinar, to start to help people to understand what integrative oncology is and what it isn't, the opportunities we have through evidence-based doing research, etc., to be able to ensure that anyone on the journey can still have some quality to life. Because I think that oftentimes that fact is not what is focused on with treatment. And integrative oncology gives us the opportunity to get the standard of care, but also to be able to have other modalities that will support you in your restoration. And so with that, I am going to stop and just say that, this is a wonderful thing that I encourage all of you to, if you don't know enough about it, to start asking questions, to make sure that whatever you're considering, you're speaking to your providers so that they understand what your interests are and make sure that what they're offering you is going to complement that and ensure that you can live life fully as well as live with quality of life. And so I'm not sure whether I'm passing it on to you, Lauren, and you'll take it away from there.
I sure will. Thank you so much, Desiree, for sharing your story and a little bit about how you kind of stumbled into integrative medicine and the benefits you've already seen. It's clear you're really passionate for it. And I think you made a great point that it's, in addition to what you're already doing, it's in addition to what's decided treatment wise, with your medical team. So thank you for sharing that. So a question came up, and Desiree or Santosh, feel free to chime in here. One of the questions that keeps coming up for us in the chat tonight is, how do I find an integrative oncologist?
Well, I'm going to start off by saying it can be a needle in a haystack. It really depends on where you reside. I think that it's safe, and perhaps, Santosh will have more insight to say that many of the comprehensive cancer centers, many of the cancer centers do have that. However, it is a reality that many people are not being treated at those particular locations. But I can also say that there are many doctors that actually are in practice that aren't at a cancer center, but it requires work. And unfortunately, I just think that is one of the things that as a patient, we are often, or our loved ones are often charged with doing, is doing the research in order to be able to find out what is available so that we can potentially tap into it in order to help us on the journey.
I'll just add to that, Desiree's lucky that you live in New York, right? I mean, I think that it's a loaded question because the first thing you have to ask is, what is an integrative oncologist? And we're still defining that. There's a paper that I think is recently come out looking at competencies, as to what defines and how do you get trained to be an integrative oncologist. There's no specific fellowship that you have to do to call yourself an integrative oncologist. So you could go to a center where they may have very limited offerings and they say, look, I'm an integrative oncologist. So I think that's part of it. And I think that gets defined differently by different people. Desiree, you mentioned your cultural background. People from different cultural backgrounds, whether you're Native American, East Asian, Indian, they may be looking for different things that they call integrative, and that are important to them. So I think part of it is a little bit of what you're looking for, and then the needle in the haystack part of it is making sure that you're in a position where you can coordinate this care. I think what happens most often is that because this is still a developing field, it isn't always all under the same roof, and so you end up shopping. And sometimes you're getting mixed messages. And I know from people that I talk to who are physicians, actually, who when they get diagnosed with cancer are just as confused as anybody else. And they ask the same questions that patients will ask about how do I navigate this system. So it's hard for anybody, so it's part of it is that it's still very confusing. And we need to, I think we're working on building the research base so that there's something you can really talk about, and that there's, we're working on guidelines, which we'll talk about later. But then as we get more knowledge, then we can kind of say, okay, this is what we think is safe, and that keeps building. And then if you're kind of going outside of that, which some people will do, what is really not safe, and what is kind of something you can experiment with, and how do we communicate all these things? Finding the right person to do that right now, I still feel like we're not all aligned is the other thing. And so you might very well see an acupuncturist, or you might see a naturopath, and some things we agree on and some things we don't. And I find that difficult too, where sometimes I'm a medical oncologist and somebody will tell me, hey, my naturopath, though, they told me that you're wrong. And it becomes one of these deals where you're like, well, and so that becomes a challenging conversation too, because you respect everybody. How do we make sure that we're giving information that is really the most helpful? And it's partly coordinated, but there's still a lot of kind of expert opinion in this. And that itself is kind of confusing. So I don't know what the easiest way is, because I think it looks different in different places. But, reach out to people and reach out to friends who've had cancer, and then look it up. And then if you can't find somebody through one of these organizations, and maybe we can help tell you who we think is well respected. I mean, because that's where it's at right now.
And I just want to just add one other thing before you move on, to say that, for me, and I encourage, people that I coach, as well as, members of the support groups that I facilitate, that it is important for you to actually vet all who is going to provide service to you. And so everyone is not equal. It doesn't matter, I say, whether or not you're an acupuncturist, you're a medical oncologist, a rad-onc, whomever, everyone is not equal. They may have trainings, but they're not equal. And it's so important that, you not just take the first person that comes along, but you vet them to understand what they're all about. But I do appreciate, and I had the good fortune that my medical oncologist was open to the idea of integrative oncology, because I will tell you that while I was searching for an oncologist, some oncologists did not want me to think about anything other than the standard of care. And I just, again, this is where you have to be able to advocate for yourself, as long as you are not trying to do anything that's harmful, that's going to cause contraindication with your standard of care. I think that you need to be able to help people to understand who you were before you were diagnosed, because oftentimes some of the treatment that you take can actually change that, because you cannot go back to doing what you were able to do, which then brings you into a whole other depression state, which we're not going to go into at this particular time. But I just want to say, you must do your homework in order to find out and be informed and be open with all of your providers.
Now, that's exactly right, Desiree. You make a great point. Jess on our team always says, it's my body and I can fire a doctor if I want to. You are not required to only see certain healthcare professionals. It's your body. You know it best, and it's going through changes, during and after treatment. And you're absolutely right that you should find, the people that work best with you and what your desired outcomes are. So that's really great advice. Thank you. So I'm going to hand it over to a few other speakers we have on tonight. Sam and Liz are going to walk us through some really fun, cool stuff that I'm personally excited for, another modality of integrative oncology. And then we're going to hand it back over to Santosh and Desiree. So I'm really excited for this part. So I'm going to mute, and Sam, I will let you go. And I think Chris will share your slides for you as well.
Sounds good. My name's Sam. I'm a board-certified music therapist and an integrative health research and data specialist at Conroe Whole Health in Cleveland. I'll let my colleague Liz introduce herself.
Hi, everyone. My name is Liz. I'm a board-certified music therapist, and I provide music therapy at Simon Cancer Center in Cleveland, Ohio.
Yeah, Liz is coming live from the studio, so we got some good stuff today. So I'm going to just do a little overview of a little bit about what music therapy is about. So when you think about music therapy, you might think about a few different images. So are we people that just go in with sound bowls and send vibrations into the universe to heal? Not quite. Are we glorified entertainers? Some doctors think that we are, but that's not really quite addressing a health goal. Or do we just go in with an iPod and say, listen to Stevie Wonder and call me in the morning? Not really. That would be music medicine, which doesn't really involve a music therapist. So if we go to the next slide, the official definition of music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional, someone like myself and Liz, a board-certified music therapist, who's completed an approved music therapy program, like the one that I did at university hospitals. And goals include addressing pain and symptom management, providing a means of coping, addressing stress and anxiety, and improving self-management skills. So if we go to the next slide, and I'm hearing I need to turn my sound up a little bit. Let's see it. Is that a little bit better? Gotcha. Well, this is where Liz and I provide music therapy services. This is Simon Cancer Center in Cleveland, Ohio. It's a freestanding cancer center, so all the services that a patient would need are in one building, from outpatient chemotherapy up to inpatient services. Next slide. We provide individualized sessions, so one-on-one on our various inpatient specialty floors, as well as outpatient and infusion, radiation, and the outpatient clinic. Next slide. During pre-COVID times, we would have outpatient group drum circles. So this was actually a virtual drum circle we would have, all electronic drums in the lobby getting together. We recently pivoted to virtual groups like this one, Healing at Home. We'll give you a sample of that in a little bit. Next slide. In the infusion space, you might be wondering how we do music therapy in this place where you're in an open environment, lots of distractions. And if you go to the next slide, you'll see how we address this through our Sidemen studio. So this is a recording studio on wheels, where in the next slide, you'll see we are able to plug various instruments, guitars, drums, microphones into this interface and have a private session through headphones so that I can hear the patient can hear me, the family member can join in, but we're not addressing sound into anywhere else in the hospital. And we're able to have private recording sessions, record songs, things like that. Next slide. As well as in the outpatient environment, we provide services where we record specialized music tools that patients can use to manage stress and anxiety. This is an example from a study we recently did with adults with sickle cell disease and chronic pain, where we were able to improve self-efficacy and reduce pain interference by providing specific music exercises. Next slide, please. We're also pivoted recently to virtual care, so we can go through this very quickly. When COVID hit, we were calling patients on the phone. Then we got more sophisticated. We were putting music stations on wheels with iPads and bringing them into isolated environments. And then we gradually pivoted to more interactive virtual groups like what we're about to demonstrate. If you go to the next slide, I want to talk briefly about data. The evidence base for music therapy. A lot of this comes from randomized control trials, which is basically a group of patients with cancer are randomized to either a music therapy group or a waitlist control or a standard treatment, and we compare outcomes, whether it's pain, stress, anxiety, whatever it might be. There have been so many randomized control trials in the field of cancer that there have been a lot of recent systematic reviews, and currently one that came out last year by GRYT, which summarized 81 trials, which found that music therapy has beneficial effects on anxiety, depression, hope, pain, fatigue in adults with cancer. And actually, music therapy with a music therapist has been more effective and more consistent than music interventions where individuals just listen to an iPod. What I'm interested in more recently is outside of a controlled environment, you're looking at music therapy in the real world. There's been some studies out of MD Anderson. And if you go to our next slide, you'll see some of our data, and we can just open these up. that we see clinically and statistically significant reductions in pain, a reduction of 1.5 units across 727 sessions, a reduction of 2.9 units on anxiety in 508 sessions, as well as reductions in fatigue. This is on the Edmonton Symptom Assessment Scale, a 0 to 10 scale. But often music therapy is best demonstrated when you can see it in person. And so with that, I'm going to pass it to Liz. And I want to make sure that I can actually share my screen because we have a songwriting template we'll be sharing.
All right. So we are going to do a little drumming together. So I'm going to start a beat. And hopefully everyone can hear that. And wherever you are, I want you to, if you're able, play along to that beat, either on your lap with your hands or with something around you, or you can just, tap along quietly. This is a good example of music therapy. I'm going to play a little blues here. We're going to do a song about self-care. It's going to be a blues. So continue to play along. I'm just going to start our song off here. When your tank isn't quite full, when the stresses of life seem to push and pull, here's what you have to do. Oh, practice self-care, yeah, make a little time for you. All right, I'm gonna stop our drum beat here for a second as Sam brings up the rest of our lyrics. We're going to do a little songwriting, and you all can help us out in the chat. So music therapy, a topic that we often cover is coping, self-care, helping our patients find new coping skills as they're going through their cancer journey, and also encouraging them to use the skills they already have and practice self-care in ways that they already know how to do. And so this second verse that we're all going to write together is a great example of that. And so we're going to just, in the chat, drop how you practice self-care for your mind, how you practice self-care for your body. We're going to pick out a few and enter them into the song. And Sam's going to type for us here. Some great ways. Great. All right, so we have a few of our answers from the chat here. So let's play through the second verse and see how it sounds. To care for our mind, we can meditate and laugh. To care for our body, we can get outside. Yoga, acupuncture, and breathe. Now that's embrace self-care. When you need it, these tips will be there. A little staticky my sound is. Okay. Thanks for letting me know. Let me see what I can do here. Okay. Hopefully that's a little better for you. So that is our second verse. Hopefully that static has left. Okay, yeah. Like I said, I've got a lot going on my end. I'm coming live from the studio, so I'll try to keep it all running smoothly for you guys. All right. So another thing we do with music therapy is we use music to help patients be transported to other places. You know, when you're inpatient or even outpatient, it can be really helpful to imagine a comforting place, a place where you find peace. And so I want to pick out a place from what we've got in the chat here. And Sam's going to type some of our responses while I work on my sound over here.
So I'm doing a little bit of fuzz. So let's imagine we're going to a place that's really, really comfortable. If you were going to go to a place that's really, really comfortable in your mind, where would you go if you could go anywhere in the world? All right, seeing a lot of the beach. Okay. All right. And if we're going to the beach, what might we see when we're at the beach together? Watch the waves, the seals, all right. The seagulls, nice. Sunrise. And what might you smell? Not if you're at the coast of Lake Erie, but if you're at the nice beach, you know? Salt, the ocean. Maybe you also smell the seals, especially if you're on the West Coast. And what might you feel on your skin or going through your hair? Energy, warmth, the sun. Gotcha. All right. I think we almost got a verse here, Liz. What do you think?
It looks good.
All right.
All right, so let's start it from the top. And I'm going to bring in our drum beat. You can play along or just listen. And we're going to go through our original song that we've all created about how we practice self-care and a peaceful beach that we like to go to, which sounds amazing right now.
When your tank isn't quite full, when the stressors of life seem to push and pull, here's what you have to do. Practice self-care, yeah, make a little time for you. To care for our mind, we can meditate and laugh. To care for our body, we can get outside, do yoga, acupuncture, or breathe. Now that's some great self-care. Whenever you need it, these tips will be there. Self-care can be a place like the beach, where you can watch the waves, the seals, the seagulls, and the sunrise, and smell the salt and the ocean. You can feel the energy, the warmth, and the sun. Oh, self-care is important. There's many things we can do. That's why we're here singing the self-care blues.
Thank you all for writing that song with us today. And I'm going to turn it back over to our next speaker.
That was awesome. Thank you so much. And as somebody sent me a message, man, artists are so clever on the pivot. There's Sam just picking it up and singing for us. Thank you so much. And thank you everyone for being flexible with some fun sound issues. But hey, that's life. That's virtual, right? I love that. That was too cool. Thank you. So now I'm going to go ahead and hand it back over to Santosh to cover some more information about a few other things. And Desirée is going to come on as well. But as before, feel free to keep dropping questions in the chat. I know one came up about acupuncture versus acupressure, and I think you might get an answer to that here pretty shortly. So Santosh, go ahead.
Thank you so much. So we're all talking about self-help and what you can do for yourself and how you can be engaged to do things that are otherwise difficult. I think music therapists and music therapy is a great example of a way to express yourself, and sometimes that's more effective than any other way to deal with complex emotions and the stress that you might be going through and various symptoms. I think there's other modalities for us to think about, and so everybody may not have access to an acupuncturist. I think acupuncture and acupressure are different. So for those who may not know, I mean, acupuncture is when you take a very thin needle and you can put it in different points around the body. It comes from traditional Chinese medicine, where there are points around the body that are supposed to stimulate blood flow and energy. And this has been worked out over many, many hundreds and thousands of years even. And that there's effects from that. And it comes from the Chinese medical system, where these meridians have an effect on health, and it's called qi. And then there's a whole system based on that. Acupressure, there's acupressure from East Asia. Actually, there's acupressure from other medical systems, like in India. They have an acupressure system also called Marma points. The bottom line is that, first of all, there are certain places where acupressure can be done, but it can really be done almost anywhere in your body. It's just a self-massage, so to speak. I'll just talk about a little bit. I'm not an acupressure expert. I don't want to say that I'm an acupressure expert, but I've been interested in acupressure for a very long time, and if you experiment with it, I find that a lot of these integrative things, there's the research side, and then there's how does it make you feel, and if it makes you feel good, then go with it, So first and foremost is your hands. You can do acupressure on your hands. You don't have to be an expert. Basically you can go around in a circle, and one thing I always learned is if there's a spot that's tender, then usually that's an area that you want to focus on. And in the Chinese system, it's really interesting, whether Chinese or Indian, it's supposed to be like this represents your body, okay? And the middle, this is your head, okay? And then these are your kidneys are here. So as you move higher, it's like your higher organs, like your lungs, okay? And then going down, this is your kidney, and you can kind of map it out between the left and right side of your body. That's something I learned. So obviously your head is up here, and then there's a back and there's a front, and you can do the same thing with your feet. And so, some people would just, you don't have to know why something is sore, but if you find something sore, you can just press on it and work on it for 2 or 3 minutes, either in a circle or just pressing in and out. And sometimes that will stimulate things. If you really do it frequently, you might even feel. Like I always used to, at least, do my foot and the middle of my hand, and I can actually feel that where my kidney is. So I think this is like a self-experimentation type deal. There's also acupressure you can do on your ears. They call that auricular acupressure. And then I would throw in there also self-abdominal massage. The idea is to have kind of a freedom of breath where you're breathing down into your navel and below your navel. And sometimes your abdomen gets restricted in terms of your breathing, especially if you get anxious. You might stop breathing fully. And you can often, if you do a massage on your abdomen, in the four corners of your abdomen. You can work things out, like whether you're constipated, whether you're sore, and if you notice that there's pain or discomfort, you don't want to press too hard. But sometimes if it's a muscular thing, you can kind of free up your breathing and get it back to being kind of centered and feel like you're actually able to breathe. And these are ways to just get to know your body again. It's okay to touch yourself in those ways and to feel kind of more intimately involved with where you are, stressed out, and what you can do to help manage those symptoms. So, there are studies. Acupressure is not as well studied as acupuncture, and I don't want to make it look like they're the exact same thing. Okay, we just don't know that. There's differences. Acupuncture, you have an expert who's basically advising you and doing an intake usually, and it's more elaborate. There are a lot of points. Acupressure is kind of something that you can do on your own, and there may be certain points for certain symptoms. So there's been studies in cancer with acupressure on fatigue, and it's moderately effective, and you can look that up online. That was done through University of Michigan. What Desirée is going to show us is acupressure that can be done for yourself for nausea. And this was obtained from a YouTube video from MD Anderson. So I'm going to turn it over to Desirée.
Thank you, Santosh. And so basically, I hope everyone can see this well. So if you raise your hand, and one of the things that's important, and I guess I should probably turn myself to the side to make it easier, take your three fingers, that's your index, your middle, and your ring finger, and put it at the base of your hand. And then what you're going to do is take your thumb and bring it up to the area just underneath your index finger. And basically, there's an area in the center of your hand. It kind of feels a little fibrous, I guess that is the right word to use. And basically, you're really just, gently massaging, rubbing this in a circular motion. And this, doing this for about 2 minutes or so can help to relieve some of the nausea that you might be experiencing. And it doesn't necessarily have to only be if you've had a cancer diagnosis. It's important to know that, sometimes people experience nausea, going on boats or cruise ships on the water, or even anything that potentially can create that sensation of nausea. This particular, again, it's using the three fingers at the base, and then putting your thumb for this, so that's at this middle area here that you are basically massaging. What's important to know is that you never want to do acupressure on an area that is open. You definitely also don't want to do it, i.e. if this is an area where you may have, lymphedema going on. So that is something that you would want to potentially have a specialist address. But if you have, for all intents and purpose, your arm is healthy enough, you can actually perform this on yourself to help relieve nausea symptoms.
All right. I'm going to talk a little bit more about something completely different. And this is just to give you guys things to think about, really. I mean, there's a lot of different modalities we talk about in integrative oncology. One of my favorite is using traditional Indian medicine. So that's called Ayurveda. And basically the concept, and this is also ancient, we don't know how old Ayurveda really is. Some people say 1,500 years, some people say thousands. There's certainly texts that are pretty old. But the idea is that we all have a manifestation, first of all, of the divine inside of us, and that we are expressions of different notes in nature, that we're not all the same, and that's okay. And so health is not you trying to look like someone else or you trying to be like someone else. It's basically manifesting the strengths of your own internal nature. So there's basically an element system, and there are 3 different what we call doshas, which are combinations of the elements. And you can be a combination of these, or you can be one. And usually it's diagnosed by a questionnaire, and somebody can check your pulse. And you can check the pulse, and I'm not going to go through that, but basically there's 3 different doshas, okay? And those are personality types. But they're intrinsic to us, and I think, it has a very practical application. I think that the people who created this medical system were ahead of their time, and they were looking at how there's, basically genetic polymorphisms and differences between different people. But it's also not just a physical thing, it tends to be a psychological thing too. So these groupings are kind of generalizations. So vata is used to denote those people who are generally thin, a little bit, creative. They have fast memory, quick memory. They tend to be more erratic, and that's kind of their description. Then there's Pitta, which are more people who are fiery. They tend to be medium build. They tend to get angry more often, have an ego, both positively and negatively. And then there's Kapha, which are people who are very sweet, tend to have a proclivity towards gaining weight, have strong bones, very loyal, sometimes prone to depression. So you can tell that all of those qualities, and some people are a mix of 2, and some people are 1, and some people are all 3, okay, at their base. And then we go through seasons of change throughout the year, and even throughout our life, where later on in life, you might be more prone to vata conditions, like dementia. And in the middle of life, you might be prone more to pitta conditions like heart attacks or ulcers. And early in life, it's more kapha. So you might get, sinusitis or respiratory issues. You tend to gain weight more, those kind of things. And it's not a positive or negative. It's how do you flow with these changes? How do you become one with nature? And there's practical suggestions that are unique to you. And usually first, especially in the setting of cancer, we usually focus on getting rid of toxicity. The imbalance usually comes from toxicity. And so Ayurveda is one of these great medical systems that talks about that in a way that we don't typically in the traditional medical world. So there's something called panchakarma, but even, dieting and different ways of getting rid of toxicity through massage, etc. So that's important. Stop putting in things into your body that are toxic, and how do you get rid of that? And then that's also a mental thing and a spiritual thing as well. How do you cleanse yourself in a sense and put things to rest? And then how do you get yourself back into balance? And usually some of that is made through diagnosis of the pulse. Some of it is just through questionnaire. And the important thing is, what is your best balance? You're not trying to take somebody who's more heavy set and force them to be thin, for example. And this is just the physical. But you're also not forcing a square block into a round hole kind of thing. If you have and any of us who've had children, if you've got a kid who's a natural football player, they may not be great at something else, but that's what they're great at. And vice versa. You have somebody who's more of a dancer, or really light on their feet. That doesn't mean that they're ready to sack a quarterback. So, I think that it's about really, really focusing on the person and what they're going through. And then also thinking about what the goal is. And the goal is to be at one with yourself and connected to nature and the universal spirit. That's what the goal is. And it's a process through life. And then if you get in touch with these principles, because they are principles, there's just a practical aspect to it that I love. And, I think there's a lot of work being done on how do we make it more, precise in terms of research. And I think I'm very optimistic about that. I actually sit on an international committee through the NIH with India, where they're working on that right now. And I'm very hopeful. In India, they use Ayurveda for cancer-related symptoms, and there's different herbs that they use, all of which is very interesting. There's a strong emphasis on meditation, for example, and yoga, obviously. as well. But a lot of it comes into getting to know yourself and what kind of routines can you create for yourself. They're very into routines and circadian rhythm to manage yourself. For example, okay, if you're a Vata person and you have Vata issues, you really need to focus on your discipline. You need to not overexert yourself, and you need to try to be more quiet, I would say. If you're a Pitta person, things that are cooling, like swimming is often good. Working on your ego, which meditation is very good for. And then there's foods that you should avoid, like you should avoid spice, for example, and avoid confrontation. And then if you're Kapha, you need to move. You need to get working. Those people can exercise more often. They can do more heavy work, for example, and you need to really avoid sweets, for example. So, there's just, I think it's beautiful to kind of give those practical, because we have no way of doing that in our normal medical system. So that's my plug for Ayurveda. I think that it's still not talked about as much in our country as obviously Chinese or East Asian medicine and other systems, but it has its place, and yoga has definitely found a strong footing in the world of cancer, which is one big contribution. If we could pull up my slides, and then I think we'll finish soon, okay? And we'll have time for questions. I wanted to plug, I told you I'm going to be the president for Society for Integrative Oncology, I think in a year or so, year and a half. And we have a couple things that we want to highlight. One is guidelines. We have been working on guidelines for integrative oncology, and there are a few that have already been published. You can see on the left, that's related to breast, and then lung cancer, and now we're working on pain, fatigue, and anxiety and depression. Stay tuned for those, but these are really big. I think that while they may not serve everybody's needs, they're creating an alliance between the world of integrative oncology and conventional oncology. This pain guideline is being done with ASCO, which is the conventional American Society for Clinical Oncology. So they're recognizing us. Many of what we talk about in terms of yoga and meditation, etc., are working their way into oncology guidelines, which is really important. Next slide. These are some resources. I didn't get edited, so just forget the top box. But these are some of the websites I like. Beyond Conventional Cancer Therapy. I have a podcast I'm going to plug, Integrative Oncology Talk, but it's done in association with Society for Integrative Oncology. And then some of these other websites are fantastic as well. Next slide. This is our mission. Next slide. And we have a conference in Scottsdale in 2022, October 20th to 22nd. You can come in person or you can join online as well. We would love to see you, and next year it's going to be in Banff, Canada, in September. Next slide. And these are our topics. We're going to be talking about an approach to pain management, fatigue. Sorry, these are the guidelines. Next slide. We talked about that. Couple things to highlight in terms of what we offer in Society for Integrative Oncology. Next slide. All right, and next slide, please. So I think we'll stop there. So I'm going to turn it over to Lauren, and she can run the question.
Yeah, great. Thank you so much. Wow, I know I learned a lot. So if anybody still has questions, feel free to keep dropping them into the chat. I know one thing some people have asked are about some of these links or resources, other integrative centers, things like that, and the slides that were shared. So just to reiterate that, once GRYT Health edits the video, so, cleans up some things, puts a pretty logo on it, we will send an email out to everyone who registered with the recording, and then also a summary blog that will contain a lot of information. We'll do some searching to get the links, make sure you all have them. But we still have time. We are taking questions for about another 5 or 10 minutes if you have them. feel free to drop them in the chat. And then after we wrap up questions, we are actually going to hang out on the Zoom, and people can talk, chat, come on camera, off camera, mute, unmute yourselves. But if you have any questions for any of our speakers, please feel free to drop them in the chat. So one question here was, I think we touched on it a little bit, but is there any way, if your oncologist isn't necessarily, your medical oncologist isn't necessarily on board or not really kind of listening to your desire on wanting to learn a little bit about integrative health, what advice do you have there?
Well, I'll just jump out there initially and just say that, I think that one of the things that we need to recognize, and I think Santosh mentioned this earlier, this is not something that's taught in medical school. And so, what I have found from doctors that I have experienced, oftentimes they may not have a familiarity. And so therefore, what they will do is not necessarily open the door. And I think that, when you may have evidence-based information, et cetera, you can bring that, to your healthcare provider and ask for a discussion. Because sometimes, with their schedules, they're not always able to learn about all what's going on at a particular point in time. And so I just think, again, emphasizing that it is so important for you to be able to advocate and sometimes, don't think that your doctor knows everything and be able to have open conversation. That's why I was saying earlier, it's so important for you to vet and identify a doctor that's going to work for you in terms of how you want to be communicated with, and one that is actually going to listen to what you have to say and then help you to have shared decision making is another important thing.
Can I just add to that? Because I completely agree. And I think as a physician, I've just seen things evolve over time where, because the access to information that's out there, we're not going to know everything. And especially when it comes to what other people have done and what experiences people have had, a lot of that comes to us. But even research, it's available to everyone now. And so, if somebody's diagnosed, there's many people who get involved personally with research and take a very active role. Some people do, some people don't, but it's okay to have that conversation, first of all. And then I think it's important for people to be aligned with your vision of how you want this to go. It can't be just like, you can't be disconnected from your oncologist or your surgeon or whatever and feel like it isn't complete, because then the care gets very fragmented. So I do feel like that's a conversation early, I would say, is just like any other relationship. I also think that Desiree's right. This is not something people are educated about, and we need to educate people, and so I mean, all of us. And they are getting more and more open-minded. I feel like 20 years ago, people were not as open-minded as they are now. I know that there are breast oncologists that I have seen that used to not really be open to this, and now they're telling their patients to use ashwagandha. No doubt. So that's just familiarity and seeing what works and getting comfortable with the whole idea of it. And it just keeps building and building.
Great. Thank you both so much for chiming in on that. One other question we got that came in was, does insurance cover integrative services? I know this one has some mixed information out there that we don't always know the answer to, or even how to find it when you're looking at your insurance benefits. So does anybody have any input on that?
Well, I probably should not get on the soapbox, but I'll take this opportunity to do so, to say that, that is one of the challenges in this country, insurance. And so the reality is that, you know, when you don't have what I will call quote unquote excellent health insurance, you may not be able to access a lot of things. And that's how cancer diagnosis actually can lead to financial toxicity and burden. And so, you know, again, you know, unfortunately, you know, some of us will not be able to participate in everything. But I am hopeful that each of us can do something. And so, again, it's important to ask questions. It's important to do your homework. Because yes, some things will have to be an out-of-pocket, expense. You know, one of the things, and this is not what we're here, we're talking about research, etc. But one of the things that I think that we all should think about, you know, once we're on the cancer journey or having any type of health, that it's important for us to take the research, the evidence-based information, and then bring it to our lawmakers, because we definitely need to address policy. Because a lot of things, I will tell you that most of us think we know what's going on in the policy realm until you have an issue, and then you realize, well, this is what's on the books. And so I just think that it's important for us to, again, we have to be informed, and we have to know the facts, and we have to be able to be comfortable and confident to say, this is me, this is what I need, this is what I want, how can I get it, and get the ears of the people that can actually make the changes in order for us to get access to more services. So unfortunately, it's not a one size fit all to say everyone can get this with the current way health insurance is designed. And so again, I would even say when you're shopping for insurance, these are the things that we should really try to find out. What is it that we're really getting? Because unfortunately, a lot of times we find out after we've had a diagnosis what we really don't have access to.
And I was just going to add to that, that the short answer is it depends on the state and it depends on the cancer center you serve and how they structure services. But we are in a new era, just as Dr. Rao said, more and more oncologists are embracing these approaches. Healthcare slowly is moving towards more value-based care. It's not about, well, can we bill for this? Can we bill for that? It's more, if you have someone with really complex cancer pain, what's the best way to treat that cancer pain? And the answer, as we should have learned now, is not to just use pharmacologic approaches. That's why in the state of Ohio, they've expanded Medicaid access for acupuncture for low back pain and migraine, because we really need to address, the opioid epidemic. So even in the hospital, in the inpatient world, we are at Simon and other cancer centers providing music therapy and acupuncture and massage because it's good care and it adds to the value and it's a better way of treating things than just relying on conventional medicine. And we hope that shift in the data helps to increase access across the board.
Right. You're exactly right. And that's, what's different and great about Society for Integrative Oncology is the research being done, which is going to then be able to support policy changes and support these things getting covered by insurance in the future. So really, really great information. I just want to give the speakers another chance. If you have any last thoughts, things you want to chime in with, please do so. I thank you all for being here. Like I said, our Zoom is going to stay open for about 20 more minutes for people to kind of relax, hang out, wave to a friend, but we'll let our speakers drop off here in about another minute or two. But thank you, Dr. Rao, Desiree, Sam, Liz. Thank you all so much. Thanks to everyone who attended. Thank you, Society for Integrative Oncology, and our GBCC 21 founding partner, Bristol Myers Squibb, for helping us make this possible. And with that, if our speakers have any last final words.
I want to just say thank you. Thank you for, putting this together, because I think that it is so important to give people an opportunity to actually understand what integrative oncology is, and hopefully what someone has learned today has actually encouraged them and empowered them to be able to go a step further, to do something that is going to help their cancer survivorship and quality of life. So I just say thank you, GRYT, Thank you, SIO. Thank you for the opportunity to be here. And it was a pleasure meeting Sam and Liz, and I was even excited. I said, okay, now I got to try and get more music therapy and not try to figure it out on my own. And always, Santosh Rao, it's a pleasure to share the stage with you again. And thank you for all you do, as well as being an open med-onc to this world of integrative oncology.
Yeah, I was just going to say, what excites me so much about this is, first of all, how we can help people. But I think that, for me personally, it's just interesting and it's fascinating. And we're all fascinating. I think life is a journey, and we're all in it together to learn more, and develop ourselves, in different ways and learn about who we really are. And, when I think of these modalities, I'm right in between, the experience, like music therapy, for example. I get fascinated, what is really happening, inside the body, inside somebody's mind, and same thing with these other things. And I think there's just a lot more there for us to understand. And we have a lot to understand about cancer, we have a lot to understand about health, and we have a lot to understand about these unique modalities that many of them are very ancient and have been part of our experience for forever when you talk about music, obviously. But what's really happening, and a lot of times we don't really think about it that way. We're looking at the symptom, it helps. But there's also the scientific side of it, which is really fascinating as well. And so I think the research and all these conversations, it brings them both together. And along the way, we're going to just keep learning more and more about ourselves and help a lot of people along the way.
Yeah, thank you all for having me today. It was wonderful. I apologize for my sound issues, but I encourage you all to look into music therapy within your community, whether that's private practice or at the medical center you go to. Sometimes there are music therapists and you don't even know they're there at your medical center. It just takes a minute to, have whoever your trusted staff members are, reach out to them over email or however they get in contact. But thank you all for coming. Thanks for being open to music. And I wish you all the best.
Any final words, Sam?
It was just really great to connect with so many of you. I've been to some of the Society of Integrative Oncology conferences, and often, we're connecting with other physicians and practitioners. But it's really, I've learned the patient advocate committees and communities that have really driven this forward. We had that question about how do we persuade doctors to understand, data can be helpful. Research articles, reviews, guidelines that we're coming out with, but really they need to see it. And it's that story that you remember of the patient's profound response to music therapy, or when nothing helped with the patient's pain, acupuncture was the thing that made the difference, or the way that massage therapy can comfort you and help you to cope and manage stress and anxiety in the hospital. Those are the things that make a difference. So the more you spread the word, that might even be more powerful than any data or randomized control trial we can put together.
Right. Thank you. Well, thank you all again. With that, our speakers, feel free to drop off. Like I said, our Zoom is going to stay open for about another 15 minutes for people to kind of hang out. So thank you all again, SIO, Bristol Myers Squibb, our wonderful speakers, and everyone who participated and showed up with an open mind to learn some new things like I know I did tonight. So thank you all.